Hi, welcome to today's Leaders in Mental Wellness and Diabetes, where you will hear insights from the top minds in the world of diabetes care. Hosted by Dr. Char.
Hello. Welcome to this podcast. I have with me today Deeksha, and she is a counseling psychologist in India. She's a community director over a diabetes foundation. And she has a mission to destigmatize mental health issues. And I'm reading all this because I never repeat it by memory. She's a type 1er girl. We have such in common. And so what do we call you? Dr. Dev? Do we call you Dr. D? What do we call you?
So I don't have a PhD yet, so you can just call me D as everyone else calls me. So that would be great.
Okay, well, Dee, it is certainly good to meet you and welcome to this podcast as well.
I am so glad to be here.
I think we should just be transparent and let everybody know my skills in technology. We recorded a podcast earlier, so you and I actually tried to meet, and then it didn't take, the recording didn't take. So yeah. My transparency is a little more than I have to give sometimes, but I think it's funny that today here we are, we're doing it again, and it's like all new. And I want you to tell me of this type 1 diabetes. When were you diagnosed, and how do you have a love to help us in the community?
So I was diagnosed at the age of 4, and I was clueless because I did not know what was happening. And I have no history of diabetes in my family, not type 2 as well. So neither on my maternal side or paternal side, anyone has diabetes. It was a shocker, of course, for my family. But yeah, then, as I was growing up, my parents never felt that I was any different. They just knew that I was taking insulin from outside, and that was it. I was as normal as any other person who's not living with diabetes. So they raised me as a woman full of strength and resilience and, very headstrong. That sort of pushed me into the direction of helping community, because I was never, I never felt stigmatized apparently. Speaking from a position of privilege, I was never stigmatized at school or at work or anywhere else because of my diabetes, simply because I did not make it an obstacle for me, because I spoke about it so normally that people were like, oh, okay, not a biggie. I never tried to see it as a flaw or show it as a flaw, more like. And yeah, that sort of pushed me into the direction of helping people. I ended up giving a few talks here and there because I was invited by my endocrinologist for the same, and people loved my story. I mean, they were just amazed by how okay I was with living with the condition since such a long time. And again, all because of my parents, because they made me who I am. So, yeah, and I then did my post graduation in psychology. I never thought that I will end up actually working with people living with type 1 diabetes. The plan was very different, but life has always something written for you. I ended up in a facility here. So I'm from Chandigarh, Punjab, and I ended up in one of the biggest hospitals, and I was working with at the endocrinology department, and I saw, there are so many mental health issues that people are facing who are living with type 1 and their caregivers as well. There was burnout written all over the place. I was like, why is no one doing anything about it? We have psychologists on board. They do understand depression and anxiety, but they do not understand depression and anxiety in context of type 1 diabetes, because first of all, they do have theoretical knowledge. No offense to any doctor out there, they are doing an amazing job, but they do not have the experiential empathy that I have. I sort of understand that, oh, when they tell that I can't do this anymore, because I have been there, I also feel like that I can't do it anymore. That is when I realized there's a dearth of mental health professionals, especially in the field of diabetes. And I found the Diabetes Foundation. Somehow, the founder director, Jazz Sethi, we got in touch with each other. I started leading the Punjab chapter. And, as and when we started working more and more in the foundation, I told Jazz that I want to have a mental health project because no one's talking about it. And why aren't we talking about it as a foundation? She was like, go ahead. So that's how we gave birth to Unwind Type 1 of her mind. And right now, it is my project at Young Leaders in Diabetes. And I'm representing India for the term of 2022 to 2024. So I will be showcasing that in front of International Diabetes Federation. The entire concept is to destigmatize mental health and making sure that mental health is a very integral part of our diabetes care management system. I mean, there should be a psychologist present when you are diagnosed with diabetes, and there should be a psychologist present even when you are visiting your doctor, because it takes a toll on you. Let's be honest about it. There's always, you have to take 180 plus more decisions a day. Of course, it's going to take a toll on you. So yeah, that's the mission. That's how I got pushed into it. And I'm just trying to empower people, trying to make it as normal as possible for them to live with type 1 diabetes. So yeah, that was more or less about what I do and how I got actually into the field of helping the community.
That is amazing that you are helping the community. Now, you do know we wouldn't blame a 4-year-old that was diagnosed. We wouldn't
Yeah.
blame that little girl to grow up and just not want to spend her life doing anything else with it. We wouldn't blame you for it, but we
Yeah.
sure are grateful to have you in the world out there helping. Now, in India, let me just for clarity, I said doctor and you said no, you don't have to have your PhD. So you can be a licensed psychologist in India off a master's degree, I'm thinking.
Yes, so I can be a counseling psychologist, but I have to do a master's in philosophy, that's MPhil, to
Uh-huh.
become a clinical or registered clinical psychologist. And then, of course, to use doctor, you need to have a doctorate.
Right. And so
So
are you in pursuit of more education with all this other stuff you're talking about?
absolutely. So I'm looking forward to enrolling myself into a PhD program sooner or later, and I'll be mostly working. My topic would be type 1 diabetes and mental health because that is my world, that is who I am, and that is what the world needs as well right now.
Well, I mean, I had to know, is this girl still a student? And is this girl doing all of this work? And are you single or married, or do you have children?
So I am in a relationship, in a committed relationship currently. My partner is a T1D as well, but here's the twist. So we did not know that we were T1, like living with type 1 for the longest period of time. We just fell in love with each other, with each other's personalities. And that's what I tell everyone that, if you are marrying, do not marry someone because they are also living with type 1 diabetes. Marry them because you're compatible and you're in love with each other. So, yeah, I am committed and madly, completely immersed in love with my partner.
Well, and it's just too many things to be coincidental that everything you touch has a little bit of type 1 in it.
Yeah, weirdly, I think this is the life which is meant for me. People feel it's a burden. Sometimes it feels like, but I'm just grateful for this life.
Oh, that is amazing. Tell me about the stress and anxiety if you have permission to do that, that a mom
Yeah.
and a dad would have to go through when their 4-year-old was diagnosed. How's that impacted their lives?
So I was very, little to understand, very young to understand what exactly was happening. But my parents, I saw their hair turning gray within 2 or 3 days. And my parents were married young, they had me when they were young. So, like within 2 or 3 days, their hair turned gray. They were so stressed. I saw my mother having bags under her eyes. My father was just, for a moment I thought that he lost himself. And I have an elder brother who is 5 years elder to me. And for suddenly he was parentified. I mean, he felt responsible for me because he was like, I have to take care of you regardless of whatever happens. And he still does. They went through a major trauma because a 4-year-old child, what could have the parents done wrong, or what could have she done wrong to get a condition which is just going to be there for her rest of, like, for the rest of her life. And yeah, there was this entire, this is very tough time. But the good part was my extended family, my maternal side of the family. We call Nana and Nani and Masi in India. So they are like maternal grandparents, and my maternal aunt. They actually were such a solid support for my parents at that point of time, because my Nanu and Nani used to stay with me for ICU. I was because I had such a severe DKA. I was in intensive care unit for 7 days.
Wow.
And they just told my parents, they were like, you go sleep, we'll take care of her. My Masi used to take care of me. My maternal aunt used to take care of all my food and, any of my needs.
Oh,
My maternal grandparents used to sleep with me. They learned how to give me insulin shots. My Masi learned how to give me insulin shots. Of course, my parents had to learn because they didn't have a choice. But I feel they took away a little anxiety and stress from my parents. But as and when my parents have been very headstrong since the very beginning. So they just accepted the fact that she has to take insulin externally now. There's nothing that we can do about it. And that's how they proceeded, and they never let me feel that there was something wrong with me.
wonderful. That's awesome.
I honestly don't know about the stress and anxiety, because I'm very sure that my mother must be crying while I was in school, just worrying about me, that how am I doing at school. My father must have not been able to concentrate on his work, but they never showed it to me upfront. They always were very strong, and because of their strength I got strength. And same was with my brother. He stopped eating everything sweet. Like, for him chocolates were a no as well, because I couldn't eat them at that time. My The first thing that my mother did, I still remember, was throwing away sugar from the house, because she knew that, because my daughter can't have it, then no one is going to have it. If she is going to be worried of it, everyone is going to get punished for it. It's very simple. But that made them healthier. So I take
Hooray,
credit for that.
hooray, 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 hooray for your family. That
Yeah.
determination to keep you healthy and their
Yeah.
ability to do what they need to do to be a part of that journey and not be victimized by saying, well, that's her, it's not me, or have it around you. That is amazing. That is
Yeah.
amazing. And that's to be celebrated when families do
Absolutely.
that.
And just one thing that I'd like to add here is, because there's a lot of stigma associated with living with type 1 diabetes. So the extended family was going to question. But my parents were so headstrong that they never let anyone question that, why does she have diabetes? Is she allowed to eat this, or is she allowed to do that? Because they were very clear in their head that no one is going to ask her such silly questions. If they have to ask, they'll ask us, and that will never get passed on to me. So they were sort of, very strong walls for me. And I feel that they took all the stigma. That is why I have been in a position of privilege. I have been the way I am, because they took it all for me. They took all the arrows with a smile. Even while bleeding, they were okay with it, because their baby girl was fine, and they just wanted to raise her right.
Well, that example, I like to have casual conversations with professionals so
Yeah,
that others that are dealing with diabetes,
yeah,
they know that we understand because of our own experiences, as well as maybe can give good counsel because of our learning. And so when
absolutely.
you put that together, I think it's a great mix for you there in India And who do you know, like in that leadership forum that you are the spokesman for India, do you by any chance get to meet those of other countries? Like, do you know who is the spokesman for the US?
I have not been able to meet them yet because, we have not had a meeting. We got the acceptance letter in January, so we are just awaiting the meeting so that we can get together, just understand what is happening in other countries as well, in each other's countries. So, not yet. I've been in touch with a few, but looking forward to having conversations with other people who have been selected as, IDFs, young leaders in diabetes from other parts of the world as well.
That young leaders in diabetes, less than 25 years old, is an amazing journey. And I'd be interested to know what you learn in my country that's similar to yours, if there's any way I can help you, and anything that you have in your country that you hear from that forum, that foundation, that learning, that you say, oh, I have this, Dr. Char, I could help you. And I think that the journey of my mental health piece is awesome. Now, you said early on that at the time of diagnosis, you wished a psychologist could be in the room. I have not been that brave to say I want us there in the room, but I've been brave enough to say, don't put me off. My dream is don't put me off until they have gone through their amenability phase of a few months, of while they're amenable and they want to change, let that wane because they can't do it on their own, and then call me in. Call me in the very beginning. Let me be a part of the team when the diagnosis is given. If they go see an educator, if they go see a nutritionist, send them to see me. Now, years ago, there was a stigma that mental health was saying that they're crazy or something's wrong. But now it's popular. We're past that. We're well past the day. Everybody knows your emotional health is important. It's valuable. And it's something that we all have to be mindful of and take care of. So I'm with you, girl. I'm right here with you. I'm saying, let's put you young leaders around the world in a position to where you have a voice and you have influence, you have the education, and dadgum, you have the experience to where you can speak to the patient after their diagnosis early on, so that you can help them emotionally carry what they need to carry emotionally in a healthy form. Because as you know, if that goes down, then that hurts your immune system too. So leaving us out only makes it worse. It doesn't just leave off something, it literally makes it worse. And I want you and everyone that's attached to your generation to feel as extreme as you do about it. And we're going to, I hope I've knocked a few doors down and opened a few doors for people younger than me. And I trust that if I've been a part of that and others who have been a part of that, I trust that you guys will just pour through those doors to every patient. I even have a dream someday of puppy dogs. Chihuahuas get low blood sugar sometimes. And I have a dream of how we can influence that. There's just so much to be done in the world for health and cure for diabetes. And maybe before you're my age, there may be some things for type 1s that I cannot even imagine. But I do know type 2s can reverse it. Now, type 2s can reverse it. And so we've come so far. There was a day that in my lifetime that nobody thought you could reverse it. And there was a time in my lifetime that my diagnosis looked pretty grim. And today you're too late to tell me that you have to die young and not be healthy. I'm already past that. I'm not young and I
Absolutely.
am healthy. And so
Absolutely.
we are on a journey together. Now,
Yeah.
to finalize this little podcast, and I so appreciate your coming, what piece of information or encouragement could you leave with the listeners that says if they had one thing to do today to better
Yeah.
themselves, to help
Yeah.
themselves as a whole person, that
Yeah.
doesn't matter if you're in India or you're in Nashville, Tennessee, what could anybody listening that needs a lifeline or just a word of encouragement, give us something?
All right. So, one thing that is my takeaway from the life that I'm leading is that you need to treat mental health like physical health. The day when you are sick, you don't feel like doing anything, you take a 24-hour off from everything. You do not stress yourself at all. You just cuddle in your quilt or your blanket and you watch your favorite show and you eat ice cream if you feel like. You just treat yourself, you take care of yourself. Treat mental health the same. The day that you're feeling extremely low, may it be a person who is living with diabetes or may it be a person not living with diabetes, please treat mental health day. If you're not feeling well mentally, treat that day as an off day. Take care of yourself, do things which help you to energize and till the time you don't feel better. It's very simple. And that's what I do. Days when fluctuations are too much, I feel burnt out. I'm like, I can't do this anymore. This is too much. I just take a day off. Not from, of course, that doesn't mean I stop taking insulin, I stop checking my sugar levels. I take insulin. But that day, I let myself go a little reckless. If my sugars are at 200, I'll be like, okay, it's fine. I'll take a correction. I'll wait. That day, I would not be like, oh my God, why is this 200? I need to bring this down immediately. I'll just go a little easy on myself. So treat, your non-mental health days when you're not feeling well as an off day is what I'll say. And at Diabesties, we have a project called Back to Basics. So we provide free one-on-one counseling for people living with type 1 diabetes. It's completely free of cost. So if you have any queries about type 1 in general, about your management, and if you're feeling burnt out, or you just want to have a chit chat about type 1 diabetes, feel free to message us. So we operate on WhatsApp. I will leave the helpline number with Dr. Char. She can probably put it in the caption somewhere. You can schedule a session with me and other people who are living with type 1. So the best thing about our panel is we have doctors, nutritionists, CDEs, mental health professionals. All of them are living with type 1 for more than 10 years. So you have got experience plus theoretical professional knowledge as well. So they'll be able to help you better. And yeah, just take care of yourself. Don't always remember that, you are here because you make this world a little better, a little brighter. And you are the glitter of this life. You're all the rainbows and stars and colors. And don't let anyone dull your light ever. Just
Thank you.
upwards and onwards.
Thank you so much. You've been such a joy to have. And if we can offer love to ourselves, we can better offer love to others. Thank you so much for being with me today. Get me that number for the WhatsApp.
Sure, I'll do
And
that.
I will absolutely, my team will get this edited. We'll get a date to you when it's going to be out, and we'll help everybody we can help together. And let's stay in
Absolutely.
touch. And it's good to be friends with you.
It is amazing to be friends with you, Dr. Charlotte. I always learn so much from you. And thank you so much for having me. This has been amazing.
Well, this is let me get her up here. This is a goodbye from me and Snickers today. Bye.
Bye.